In a happier story this evening, the last of the nurses who caught Ebola in a Dallas hospital left an Atlanta hospital today. Amber Vinson is now disease-free. At the White House, the president is still dealing with an outbreak of confusion over how the government is handling Ebola, and Major Garrett is there.
President Obama struggled today to explain why the federal government, states, and the military are treating Americans returning from Ebola-stricken countries differently. He supported new guidelines from the Centers for Disease Control that do not require a 21-day quarantine for someone without Ebola symptoms.
We don't want to discourage our healthcare workers from going to the front lines and dealing with this in an effective way.
But states are still free to implement tighter restrictions, and the Joint Chiefs of Staff have recommended a different policy for the military, a mandatory 3-week quarantine period even if troops do not come in direct contact with an Ebola patient. Already, Army soldiers who had been building Ebola treatment centers in Liberia are being quarantined on a base in Italy. Why the difference? Soldiers have to follow orders, the president said, while returning healthcare workers have legal rights and should not be stigmatized.
But we don't want to do things that aren't based on science and best practices, because if we do, then we're just putting another barrier on somebody who's already doing really important work on our behalf.
The confusion has raised the question among headline writers. Where is the president's newly appointed Ebola response coordinator, Ron Klain? He's been on the job a week, and the White House says he has briefed the president 6 times, but Klain's only been seen on camera once. A new CBS News poll finds 47% of the country approves of the president's handling of the Ebola crisis. 41% disapprove. As for the Centers for Disease Control and Prevention, Scott, 57% told us they believe the agency is doing a fair or poor job.
Major Garrett at the White House tonight. Major, thank you very much.